Episode 15 of How to Become a Doctor video podcast. If you haven't seen our other episodes, definitely check those out. But we have a special guest today, Robert Melvin from St. George University School of Medicine. He's the Associate Director of Admissions over there. So, Robert, I'll let you introduce yourself and just share a little bit about your title, your role over there.
Absolutely. Thank you again for having me. Robert Melvin from St. George University. I've been with SGU now for about 5 years. I'm based in Houston, so my role takes up about 5 states: Texas, Louisiana, Oklahoma, New Mexico, and Arkansas, as well as Colorado. And so with that, my role is pretty much to kind of get the good news out there about SGU and kind of invite students to learn more about the opportunities and benefits of possibly going through SGU to begin their medical school career. So presentations, pre-med club visits, health fairs, and then awesome opportunities like this where I get to speak directly to you guys with your advisors from LSU on the line. So very excited to be here.
Awesome. Yeah. Why don't you give us a little overview? A lot of people might not know about St. George University School of Medicine. So just kind of your class size, your campus setting, some curriculum that they'll go through there.
Absolutely. So St. George University, Caribbean-based medical school located on the beautiful island of Grenada. Very small island, smaller than Baton Rouge. It's like 22 miles long, about 12 miles wide, the entire country. So you can get around the entire country with literally one bus ride. But that country that has produced over 20,000 physicians. SGU is about 44 years old, the first Caribbean medical school. And with that, like I said, we've produced well over 20,000 physicians. The benefit, so the difference of really SGU is that while US medical schools historically have smaller traditional campus size of maybe 100 to 150 incoming, SGU has the benefit of having a much larger opportunity for that. So this allows more students to apply. Our average fall incoming class is about 1,000, and our average spring class is about 400 to 500. And even with that, we still are doing amazing match rates, about 93% match over the last 3 years, and a multitude of different specialties. This past year, we have matched 1,020 students, I believe, up to the most recent number. So still matching students at a very high rate, and 21 different specialties was the last one I checked into. So just a really cool opportunity to expose yourself to different healthcare opportunities, as students will then work in the hospitals in Grenada, but still with the same curriculum as you would get here in the US, because we take the exact same board exams. Every single test is in that USMLE format to prepare you for that test. So we look at the best practices that are done in the US, we mirror them, and try our best to make sure as many students as possible come through, are successful, and then go on to match back here in the US.
Okay, great. Well, why don't you share a little more about that curriculum, right? Because, obviously every medical school does, their clinicals, pre-clinicals a little different. So just that kind of, 4-year timeline, what that would look like for a student.
Absolutely. So it's the same 4 years. The way the program works, the difference is that your first 2 years will be on the island of Grenada. So it's a massive university based in the Caribbean. You will be there for 2 years. Same winter break, same summer breaks as you would get here in the US. It's just that you do your basic sciences there. You take your step 1 exam. Immediately after passing that, you then begin your clinical rotation. So SGU has 75 clinical hospitals in the US, and you choose where you want to go, not dependent upon GPA or any type of competitiveness. Because we have more clinical spots than we do students, you decide where you want to go depending upon what type of doctor you want to be. So if you want to get back home, close to Baton Rouge, you want to school there, we actually have a brand new clinical rotation there. I believe I have to think it's Baton Rouge Methodist, Baton Rouge
General.
There you go. That's the one.
Cool.
Yeah. So that's one of our newest affiliate hospitals, and so students now can choose to go there and do their rotations. That 3rd year, you have to be part of our core. So our core rotations are 75 hospitals across the country. You have to do that 3rd year there. And that 4th year, that's where you're really deciding on what type of doctor you want to be, where you want to practice, and you can then go outside of our core and rotate into hospitals that we will deem ACMG accredited, as well as make sure they're on your right path and they have the program for you that will get you to your goal, of being a physician. And then that's that. With us being even in the Caribbean with that process, we're still the largest producer of doctors to the US in the world right now. And so that curriculum, that clinical rotations is a big part of why our students are successful.
All right, great. So, well, no, thanks for sharing all that. It's helpful just to give that landscape. A lot of students aren't even aware of exactly, the clinicals versus preclinicals and all that. So, let's talk a little bit about the application, timeline process there. You mentioned you guys have two different starting classes, but why don't you just mention, how do you apply to SGU School of Medicine? Is it through the AMCAS? You guys have your own application, and then what would that timeline look like to apply?
Awesome. So I'll answer. Yeah, I'll do like let's do application start times, and then we'll do how the application process works.
Perfect.
So we have our traditional start term in August, but in addition to that, we have a January and an April term. Our January term, they're intentionally there for students because our students are usually a little bit non-traditional, being a little bit older. They may have a family, they may have been on a master's program, so they may be graduating in December, or they may not be ready to go to school immediately in the fall. That January and that April term are there for that reason. And so this process allows them to still match at the exact same time. So always kind of very visual. So if you do your traditional, you go fall, spring, fall, spring, fall, spring, fall, spring. You match in March, you graduate in May, you begin, your residency that summer. If you do our spring term, you catch up to the August class behind you. So you go spring, fall, you graduate in December. That semester is yours to, whether it be to practice for your step 2 or step 1, to do extra clinical rotations, to do research, to travel, to get married, but you still match at the exact same time of the August class coming behind you. So you lose no time applying in the January terms. Now, the application process, the way that works, we are rolling admissions applications, meaning we do not have a specific date where we give you a decision. The moment you apply to us, we begin communicating with you immediately. We don't need a full packet to begin reviewing you. In that process, we look at your unofficial transcripts. We kind of go over your MCAS, things like that. So our officers work with you kind of more informally to kind of see where you are before you start gathering and massing all these different documents and things like that. We want to make sure you're in the best position possible leading into that. And what we accept. So we have our own application website on the website at sgu.edu. But in addition to that, if you apply through AMCAS or the ACOMAS application, or if you've done like a state application, for example, Texas has the TIMDAS application, you can save that application as a PDF, upload it directly through our system, and we'll take it through that. We know the application takes about an hour. For medical school, we don't want students having to do that more than once. So once you complete any application, you can use that application to apply to us. If you haven't used that, we have our own application website on the website as well that you may use.
Okay, great. That's helpful information there, and to figure that out. So, these applicants, what are you guys looking for, in an applicant? What are some of the big things that you kind of have to make it into SGU?
Yeah, competitive wise, in regards to just basic numbers, for competitive applicant, we look at about a 500 on the MCAT, 3.4 GPA, and we want your upper level sciences to be above that 3.5, 3.6 range. That shows competitive nature. Now we say competitive because we do not have a minimum or you automatically end. I tell our students, everything about your pie is going to be individually kind of sliced. If you're coming directly from undergrad, we expect that you have, experiences in the undergrad, whether it be, being a part of the AMSA club or pre-med club, or doing different, things on campus and access that you may have. Your recommendation letters are probably going to come from your science professors and things of that nature. So we want, obviously, we're going to put more emphasis on your transcripts, MCAT, and then experiences in college. We don't have a minimum of, say, shadow hours or volunteer hours, because it's 100 hours shadowing versus 101 hours. I don't believe there's one better or worse. We want to see consistency. We want to see a student who is actively involved in healthcare and wanting to be a doctor. I tell students all the time, don't shadow for the school, shadow for yourself as well. You need to experience what it is to be in the hospital and, right, that sort of physician lifestyle. And so that will come out in your personal statement of your dedication and passion to healthcare. In addition to that, we want to see a student who's been involved outside of that. This field of being a physician is one of the few that you have to be as equally smart as you are personally. So we want to see a student that's done things outside of the classroom, whether it be sports, band, working, your experiences. We want to hear that as well. So I say it intentionally. We look for as many reasons to accept you versus reasons to deny you. We don't look at biographical information as a negative at all, whether it be your age, how long it was since you were in school. If you can satisfy the requirements to show yourself as a competitive applicant, that will be, that's more than enough to get the ball rolling, to get you into that process and hopefully get you to an interview where you can really shine and speak on your experiences.
That's great. Thanks for sharing all that. And it is insightful. I do want to, capture a little bit about, the time there, at the campus for those 2 years. What is it like, being in medical school, maybe far away from home for some people? It obviously is a limited amount of time, but,
Yeah.
what's that experience like? What are some of the things that students share?
Yeah. I think every student shares the exact same. As soon as they get to campus, it's like a deer in headlights. I said fear of, I'm in a brand new country. It's this is very, very, very different. But it's pretty much an immediate switch because the country is so small and the campus is so large. Everything happening is involved with SGU. So similar to Baton Rouge, that college town feel. Like as soon as you cross over, you're seeing purple and gold everywhere you go. That's how it feels to be an SGU with that process, because it's very much not competitive, very collaborative kind of space. Because when you're on an island and nobody has, let's say, the comforts of home, where everybody kind of works together, kind of that creates another adaptable student. And I've heard many times students who graduated were like, I can't wait to go back. Like those 2 years went too fast. Like where else can you literally, work and learn with a cohort of 1,000 students who are all trying to be doctors, basically in paradise. And so I would say the lifestyle is it's rigorous. I mean, you're in medical school. I'm not going to, it's beautiful to look out, but it's drinking water from fire hose. And so with that, because everybody's also in that same experience, you're always with somebody working together to work to make it better. The second years are renting cars out to their first years. The professors live on the same island. So you may catch them out. That's a time to talk about, maybe a project coming up or different PowerPoints you may have questions about or different slides. So it's a very much, I would say, collaborative, an amazing experience to really broaden your horizon as not only a future healthcare provider, but as a future person. This allows you to be more comfortable with working with patients from different backgrounds, because you've now literally, gone overseas and learned medicine in a place it's very unfamiliar to your upbringing. So it's very similar, like, it's a college feel in regards to the same, we have intramural sports and, clubs and, there's, these massive, because everybody's on the same exam schedule, because it's just medical school, there are massive parties that can be scheduled for passing this particular exam because everybody just passed it, right? Like everybody's kind of in that same boat. So everybody celebrates at the same time. So I tell students, I was asking, like, how do you know when somebody's not going to be successful? And they're like, well, if they're the only one partying and everybody else is in the library, they're probably gonna be the one. If they're the only one at the beach, you're probably doing something wrong. Because the school moves as one. It's very easy to find your group, your study group, your amazing friends, or meet somebody on the island, and then that's kind of how you move throughout that process of being a successful student while on campus. So yeah.
Okay, yeah, no, that's great. Appreciate you sharing that. And I would like to, then kind of move on, talking about that third and fourth year. You talked about those 75 sites. Why don't you just share maybe some of the bigger sites, or maybe some of the places that students find themselves doing their clinical rotations at?
Yeah, our largest collection will be in the Northeast, so New York, New Jersey area. We have, I believe, 15 sites in that area. So there's a large circle of like a medical district in the New York area where students are going to learn. In addition to that, we have a couple in California area, Arrowhead Hospital in LA, as well as one of our largest pediatric sort of match sites, University of Miami School, Miami Children's Hospital in Florida. So we kind of, our goal is to get as many as possible kind of in different areas, but Louisiana being our newer one. Whereas we have a couple in the Midwest, sort of that Michigan, Illinois area as well. I can't off the top of my head. I could read them off the top
Yeah,
of my
no,
head.
no worries. That's helpful. So I guess how did this get set up, right? Because obviously in the second year, probably
Mhm.
connecting that. So how does a student, so let's say a student wants to come back to Baton Rouge or wants to go to Cali, like what does that process look like for them to find out where they're going to be?
Yeah. So they work with our clinical rotation, our clinical center or department, and their job is to basically, all right, Matt, you want to be this doctor in this area, right? And so we pull, let's say, I'm gonna use pediatric because I just said it, pediatric doctor in Florida. We're gonna pull every pediatric doctor that's ever matched in Florida from our extensive list. When we have 20,000 physicians, you now have 20,000 data points of what worked for these students. We pull them. We say, all right, Matt, this is what these 40 students who did exactly what you wanted to do were successful. Here's where they rotated. Here's where they, their match, their scores and things of that nature. So now you have an opportunity to say, okay, well, let's follow that in that path exactly. And we do that. We lock those in. You put your top 3 clinical sites in. It could be whether because of the field you want to go into. It could be because you met somebody on the island and you want to rotate with them. It could be it's close to home. Whatever it may be, we do our best to match that to that. We have about an 85% match rate of that clinical site in that
Okay,
first.
great. So, yeah, and then I guess with clinicals, obviously the official match. Sorry, the residency is the official match there. What are some of the most common specialties for SGU grads to be working in?
Yeah, top 2, family medicine, internal medicine. That's the most jobs out there. That's our big 2. But right after that, we have a lot of this past match, a lot of surgery as well as emergency medicine come out. And then it's like a large 2 chunks with internal and family medicine. Then sort of your surgery, peds, surgery, peds, and emergency medicine. And then surgery, peds, medicine, and then what was the next one? That's what kind of get. We had like maybe 10 to 15 matching neurology. I actually pulled a list up while we were talking about that. Let me just pull this 1 second. So more popular psychiatry. We had quite a few matching anesthesiology. So neurology, family. Yeah, so I would say the big 3, your big 4 are going to be your core rotations that we match into.
Right.
100%. But you are definitely, we definitely push that whatever type of doctor you would like to be, don't limit yourself like thinking that, oh, if I go here, this is what, I have to do, or this is what they push me to do. We want you to go into the specialty of your choice. I'm kind of just scrolling through right now.
Cool.
So, a lot of OBG, pathology, orthopedic surgery, pediatrics, physical medicine and rehabilitation, plastic. We had 2 plastic surgery matches, psychiatry, a lot of surgery, and then that's a couple urology and vascular surgery students who matched this past year. So our match list is publicized every single year, and so we literally can go through every single year and like break down where where they matched and what they matched in.
That's great. Yeah, I think especially for you guys listening, you don't have to have it all figured out, right? So, a lot of students, they're gonna have no idea, going in. That's okay, but it is good. Some students are aware of that. It's good for them to, if that's one of the ones in their list, see you guys have matched there. So that's great. So we could talk all day. There's a lot to say, but of course they can connect with you. But just wanted to see, do you have any other advice or information, about SGU that maybe we didn't cover that you wanted to say?
Yeah, we are I would say our expression of what it is that we want you to be a doctor, and that's it. I tell students all the time, I push them, apply to apply to US schools, like apply to where the dream schools and where you want to go. SGU is a great opportunity for students who want to sort of, like I said, broaden their horizon and maybe experience something different than what they've experienced here in the US. Or for students who maybe been outside of school for a couple of years, they've graduated, and that transition year, being on wait lists and things like that. SGU can get you to your goal of still becoming a physician, practicing right here in the US. We're very excited about that. We've had quite a few. Actually, LSU is our #1 feeder school from Louisiana. We have quite a few students who've gone and been very successful coming back here to the States as a physician, and we'd love to connect with anybody else who has any questions about SGU. the process, success rates, and maybe get you contact with a grad who's doing something you're doing, and you can pick their brain as well.
That's great. And I think for sharing all that, I do want to open it up for questions, just leave some time for that. So if anyone has any questions, Robbie, if you wanted to mention anything.
Yeah, I was just gonna a couple things I wanted to see if you could talk about a little bit. So I've actually had a chance to go to the campus. It's absolutely gorgeous, by the way. But just for students who are concerned about moving, what does the medical school do to help them transition to Grenada, to the island, in terms of finding a place to live? And that, I know you guys have residence halls, but what does the university do to help students make that transition?
Yeah, so we as you said, so we have enough residence halls that if you're on campus, you have a place to live, period. So it's similar to that, if you're going to undergrad, we have a housing department. We do our best to make sure that you're matched. Where you're going to stay, whether it be within our roommate or your own. In addition to that, we have a lot of students who are married, who don't want to live in the dormitories, or the only two reasons you can't live in a dorm is if you have an animal or if you have a kid, because we have a vet school as well. So a lot of our students either bring down an animal or find an animal on the island and then keep it. So we also do a great job of connecting you with the local housing around SGU, very similar to Baton Rouge, where you say College Town, where there may be 10 to 15 apartment complexes that only rent out to our students. And even though they have their own individual landlords, they work through the SGU process. We still make sure we keep the checks and balances of them, making sure they are taking care of you at a high level. You know where you're going to go as soon as you get there. And because you're also flying to a new country, once you get admitted, we have a full travel team, and their job is, make sure you're planning out your flight. They confirm before we go your flight, the best possible flight of getting you there, what you need to pack, what you can't pack, ways of getting to ship things down. So it's because we've done it so long, it's kind of, as things kind of changing with, different COVID policies and things like that, we're always up to date to make sure that our students have the easiest transition possible of literally you're moving yourself and moving to a different country to go to school. We do our best to make sure that it is as easy as possible, as convenient as possible for them, because we don't want that to be the issue. Medical schools will take care of that. The rigor of medical schools will be enough for that. We want to make sure if you get to campus, that's as easy and taken care of as possible.
Yeah, and I mean, I think the other good thing is the official language is English, so you don't have to learn another language. But can you talk a little bit about financial aid? Like, are students eligible for loans and that kind of thing, grants?
Absolutely. If you were able to use the FAFSA in undergrad, you were able to use the FAFSA as well at SGU. I think about 82% of our students take some form of financial aid or use some form of financial aid at SGU. We had to earn that. That is not given to all Caribbean medical schools because we're not on U.S. land. So that was something we're very proud of, and we make sure we take care of our students with that. We also give out a lot of scholarship dollars. Last year, we gave about 84 million. So I tell students all the time, apply early, see where you fall, because there can be scholarship dollars out there available for you. So the way we have it is that we run you through the application through the scholarship portal, and we, create an awards packet. Once you see that, you can then go into your FAFSA and then either borrow up to the full amount, and we built in past just tuition and fees up to room and board, miscellaneous as well, because you will not have time to really work and support yourself during that process. So you can borrow up to enough to be able to survive, when you come back from clinical rotations, get apartments, things of that nature as well, throughout your 4 years.
Yeah.
Right. Yeah, no, that's very helpful information. I think just the last thing is just kind of sharing a little bit about like the requirements, right? So like letters of recommendation, interview, like what are kind of some of those you have to have, to get in?
Yeah. So what we're looking for, we would like every MCAT ever attempted. I know students like to hire the one that they don't like. We like to see it as well, but because it shows progression, we want to see that. We want to see, your official MCAT, official transcripts from all institutions attended. Sometimes universities will put like the community college hours on there. We still need that official transcript from that college, everyone you've attended, whether it be one class or entire degree from that as well. A minimum of 2 recommendation letters. We would like one if you are within a certain, it's kind of subjective depending upon how long you've been outside of school, but we love for one to be from a science professor. The other may be from a physician you may shadow or somebody in that field who can speak highly of you going to medical school. After that, let's see, recommendation letters, MCAT transcripts, and
And
that's
classes, like in what coursework do they have to have?
So as long as you are doing the pre-med, pre-health core curriculum at every institution here in the US, you can come in with any type of degree, as long as those core classes are taken care of, which is a full list online. Like if you're doing a pre-health or pre-med track at any university, it will cover the classes that are required for SGU.
Okay, great. Well, good. All right. So obviously, we'll wrap up our time here. You couldn't say everything there ever was to say. So if someone wants to find out more about SGU, wants to connect with you, how can they do that?
Absolutely. So my email address is rmelvin@sgu.edu. First letter of my first name, last name at SGU. I am your, like I said, your Houston rep. And so I travel the entire area. I'm always in Louisiana for different events, different colleges. So if you'd like to meet, whether it be virtually or in person, we can make that happen. In addition to that, we have a multitude of information sessions where either in person and virtually. So if you go to sgu.edu and search SGU information sessions, we have a full list of virtual sessions where we cover not only the process of applying, but we also do specifics of women in medicine, minorities in medicine. We go directly into students who've done just surgery, and we talk to them in their transition and their process in different areas of surgery and specialties as well. So that full list is there. We literally update it every day because we have a bunch of Roberts kind of across the country who are doing events everywhere. So if we're not directly in your area, we definitely have a virtual session within the week that you can 100% jump on and learn about SGU at any time.
Awesome. Thanks so much. Well, appreciate the time. And you guys reach out to Robert if you have questions.
Absolutely. Thank you, guys.
Thanks, Robert.